Hello, everyone. Welcome to today's Wellness Works webinar, Gut Health Coded, Breath Testing for SIBO and IBS, featuring Dr. Andrew Lenhardt. My name is Emily DeLuca, and I am the Digital Marketing Manager at Biotics Research Corporation. Please keep in mind that all of our webinars are recorded and uploaded to our website within 24 hours. If you have any questions during the webinar, please type them in the space provided and they will be addressed at the end as time permits. Dr. Andrew Lenhardt is a board-certified family doctor with an extensive background in functional and integrative medicine. He is the author of 2 books, The Best of All Worlds, A Family Doctor's Path to Integrative Medicine, and Emotional Intelligence in a Complex World. Dr. Lenhardt is on the faculty of Tufts Medical School, Endicott College, and Yale University, and has been teaching medical students and nurse practitioner students for over 15 years. He has developed the algorithms used for the Root Finder tool at Complex Health Solutions and has published scholarly articles. In his personal life, Dr. Lenhardt is married with 3 sons and has 2 Pomeranians. His interests include pickleball, bridge, and exotic travel. Welcome, Dr. Lenhardt, and thank you so much for joining us today.
Thank you so much, and thank you everyone for attending. Glad to be here. So I'm going to work my way through the slides. Hopefully I am. Let's see. My able assistant, Bill, will help me out. Okay. So part of the theme of the presentation today is differentiating between traditional medicine and functional integrative medicine. As an MD, I certainly come from the traditional world, but I don't choose sides necessarily. And as she alluded to in the book that I wrote, I'm really interested in taking the best from all aspects of health and wellness in medicine. So the term irritable bowel syndrome, as probably most in the audience know, is really a catch-all term for a person who has chronic gastrointestinal symptoms that can include abdominal pain, constipation, diarrhea, bloating, or other. And the presumption of this presentation is that a person with this diagnosis has already been assessed by providers, and they have gone through a process of ruling out colon cancer, stomach cancer, inflammatory bowel disease, gastritis, and some of the other causes of chronic gastrointestinal symptoms. So from a functional medicine perspective, a functional provider would never use a term like irritable bowel syndrome, or maybe it's proper to say they would never accept that, because the goal is to figure out the underlying root causes for each individual. So the first slide that we're looking at has some on this list. And we will go into these more specifically. Now, I will say that one of the good trends in medicine and health is that the 2 worlds seem to be coming together more over time, and that's a very positive development. And an amazing thing happened from my perspective about 6 months ago when I was in the Epic medical record system. And for some reason, I searched on dysbiosis and found that there was indeed an accepted diagnosis and code, which is listed on the screen. And that was shocking to me at the time that the mainstream world would acknowledge dysbiosis. Okay, next slide, please. Okay, next slide, please. So these are more root causes, but we're going to get into some of the specifics anyway. So. Okay, so for each of these root causes, my overview of them is going to be relatively brief, but the point will be the same, which is that we want to go deeper and with each individual to try to understand the underlying elements in play. So a very small percentage of people diagnosed with constipation, predominant irritable bowel syndrome, would have hypothyroidism as the primary cause. A big difference of the 2 worlds of medicine is that in traditional medicine, often there will be limited testing done, and the testing will be interpreted in a very black and white fashion. And thyroid management is a very good example of this. And so for most of medical history, if there was a question about underactive thyroid, most providers would do a TSH by itself. If the TSH was normal, they would consider thyroid dysfunction ruled out. Most functional integrated naturopathic providers are well aware that you have to go beyond this one blood test. And if we really want to know or get a sense of whether the thyroid could be playing a role in chronic constipation, we need other labs, including free T3, free T4, sometimes Hashimoto's markers, and sometimes we would track things like basal body temperature as well to get a more complete picture. So the best approach to any issue is to look at the history and the physical exam and a variety of tests, and to put all of that information together in the aggregate to make the best decisions. Next slide. So a recurring theme that you'll see in these initial slides is that many of these underlying root causes are underdiagnosed or undermanaged. With chronic intestinal parasites, that's certainly the case. This would be a very small percentage of people who are diagnosed with diarrhea predominant irritable bowel syndrome potentially would have a chronic intestinal parasite. In a traditional lab, and I started medical school in 1994, and what we were taught was to do an ova and parasite stool test, and really much of what is pursued in medicine is the same as it was 10 or 20 or 30 years ago. So still to this day, if someone wanted to rule out parasites, they would do a very limited basics type of stool testing covered by insurance. But functional integrative naturopathic providers are very versed and comfortable with something called comprehensive stool analysis that can be run through many different labs around the country, and they would go well beyond the standard ova and parasite. One in particular will check for over 30 different parasites as opposed to 3 or 4. So sometimes this would be necessary if parasites were suspected. So mast cell activation is an underlying root cause. It's been getting more attention the last 3 or 4 years. It's a fairly complex subject. And in my experience with allergists and specialists around me, I think there's some fundamental misunderstanding of what somebody like me is referring to. This has nothing to do with the relatively rare diagnosis of mastocytosis. This condition is relatively common, I would say, in people who have chronic complex health problems, especially people with chronic pain. It is very difficult to rule this in or rule this out with blood and urine tests. There are blood and urine tests that can be done, but mostly this is a clinical diagnosis in my experience. Many people with mast cell activation will have unexplained hives, flushing to the face, unexplained headaches, bruising, and other symptoms. In one survey from a number of years ago, the #1 most common symptom of mast cell activation was unexplained abdominal pain. That is the reason why this is included in the presentation, because some percentage of people diagnosed with pain predominant IBS would be caused by mast cell issues. So now we're getting into more of the meat of the presentation. So these issues, leaky gut syndrome, food sensitivities, malabsorption, are incredibly common. And most in the functional integrative naturopathic world would consider these in the majority of people. Very complicated subject. I think there is growing overlap between the two health worlds. There's one individual in particular, Alessio Fasano, down the road from me at Mass General and Harvard Medical School, who's been doing work for the last 10 or 15 years. And he has shown that non-celiac gluten sensitivity is incredibly common in the general population. And he helped to identify the marker zonulin that can be used as a measure of leaky gut. Again, I alluded to this before, but so dysbiosis is a term that more and more people and providers are becoming familiar with. Dysbiosis is a very general term that means that the normal or the microbial flora is out of balance. One of my standard lines that I've said many times to patients is it's much easier to screw up the microbiome than it is to fix it. There are many, many contributors to dysbiosis. Antibiotics, steroids, stress are some of the more common ones. Research is building, research is growing. In terms of, there'll be a really good slide coming up that will get into this in more detail but generally speaking, a person can have overgrowth of different types of bacteria, deficiency of healthy bacteria, that should say healthy, not health, and or fungal overgrowth. The and or part of this is important because as much as it would make our lives easier if a person came in with a health problem and there was one very specific underlying cause that we could easily identify, it doesn't always work like that, and sometimes we have to bring in many different elements for the same underlying condition. Okay, so this is the slide I was alluding to. It really is just a representation of the way that I look at dysbiosis. It's in some ways it's self-evident, but it's worth going through a bit. So we see on the right side, we see mixed overgrowth, which I generally mean bacterial and fungal overgrowth together, which is incredibly common in my world. A person can have fungal overgrowth alone. A person can have bacterial overgrowth alone. Within bacterial overgrowth, you can have SIBO. Within SIBO, you can have methane producing bacteria and or hydrogen producing bacteria, but you certainly can have other forms of bacterial overgrowth. And there are different tests that can be done. Breath testing, we will talk about extensively later in the presentation, but also comprehensive stool analysis would be a way to investigate for the totality of dysbiosis. Now, I put in the lower right hand this wild card of biofilm. The majority of bacteria in our bodies, in the gut and sinuses and other areas, have the potential to make biofilms as part of their defense mechanism. Biofilm is a slime layer. Biofilm is a evolved mechanism, and that can be an important element for treatment, and sometimes explains why people do not respond to a good treatment regimen, and biofilm busters are often needed as part of the regimen. Okay, so this is just a continuation of the theme with SIBO, with bacterial overgrowth. Some percentage have SIBO specifically. Within SIBO, it's methane or hydrogen, as I said. There's been a shift the last year or two or longer from lactulose to glucose as the substrate for the breath test. So this is these are some of the other issues you can see within the gastrointestinal tract. Certain percentage of people have lactose intolerance, and a breath test would be a good way to rule that out more definitively. Many millions of people have low stomach acid. This would be considered a normal part of aging, but also relates in some ways to stress. And some very high percentage of Americans are on proton pump inhibitors like omeprazole and Prilosec that artificially suppress the stomach acid. This is a big differentiation point, as many others, between the traditional medical world and the naturopaths. The traditional medical world seems very comfortable putting people on acid blockers, and the naturopaths would look at this as a bit of an aberration. But again, getting into that in more detail is beyond the scope of this presentation. As people age, not only do they tend to have lower stomach acid, but they tend to have deficiency of digestive enzymes, So the majority of people, and pretty much all people at 50s, 60s, 70s, and beyond, are going to have low stomach acid and deficiency of enzymes, and they won't break down their food, and that can cause fermentation and bloating and gas and discomfort and some other gastrointestinal symptoms. The last one on the slide is exocrine pancreatic insufficiency. This is a relatively new, but certainly a real issue. The cynical side of me wonders if it's more in the forefront because I forget who it is, but some pharmaceutical company has a treatment for this condition. So they've been promoting testing for this, but it's not necessarily anything nefarious. And this is a real issue. And so it's good for us to be testing for it and identifying it, and having it as a unique root cause that has to be pursued in some people. Okay, so the research would say that the #1 cause for someone diagnosed with IBS is almost certainly SIBO. There was an NIH study in 2014 that I would say was a groundbreaking, very important study for a variety of reasons. In that study, 56% of those diagnosed with IBS were found to have SIBO, which is, to me and probably to others, is a very staggering figure. And we will get more into this going forward. So as part of this presentation is to elucidate underlying root causes that might be in play, but another part of it is really to simplify the approach to IBS. If 50% or more of people with IBS have SIBO, then that makes life easier for us, and we can jump right to doing breath testing. Nowadays, through groups like AllClear, it's an easy, convenient, super simple. There are YouTube videos on how to do it. It doesn't take very long. The results come back in 24 to 48 hours. It's affordable, easy to interpret, and the treatment regimens are fairly straightforward as well. So some of the details on what would be the more modern versions of SIBO testing are listed below. Glucose is absorbed more in the upper bowel. So if in the small percentage of distal SIBO, that could be missed. Lactulose testing has higher false positive rates than glucose. If you go beyond 90 minutes, it becomes more challenging to interpret the results. And sometimes, with a lot of these issues I've been discussing, clinical judgment is, of course, part of the decision making, and a response to treatment would, of course, be a variable we would factor in to the overall management. Okay, what are the treatment options for SIBO? Some of you may be familiar with something called the elemental formula diet. It is a very simple medieval approach to bacterial overgrowth. Basically, you are starving all bacteria by depriving the bacteria of calories. And so the person, usually for a week or two and sometimes longer, will do this elemental formula powder, and this has a very high effectiveness rate, but it is very difficult, very challenging, miserable. And over the last 7 or 8 years I've been familiar with this option, I've only had 1 or 2 people follow it through to the end. The more typical approach would be antibiotics, and with rifaximin as the most commonly used antibiotic in the traditional medical world. That can be used with or without neomycin, and there are many other antibiotics, Flagyl, Augmentin, cephalosporins, they also can be used in combination. There are herbals that can be used, and I would say biotics research has been at the forefront of natural herbal therapy for many, many years. And then the nature of integrative medicine is to use different combinations, and sometimes pharmaceutical with natural. Okay. So biotics research, as being at the forefront of this for many years, has a gut microbial support kit. The goal of this kit, of course, is to make the process as simple as possible. And we will get into some of the response rates of this herbal microbial therapy coming up. So in a continuation from this, what I would consider a very important study, the study was very important for many reasons. It did represent a collaboration between traditional medicine at a place like Johns Hopkins, which when Johns Hopkins is involved, there's immediate credibility. The same as Fasano at Harvard and MGH. It is hard to ignore or disregard these types of sources. So these are some of the details of the study. About 400 patients were enrolled and suspected. There was even a higher rate of positivity when you looked at the details of it. And then they compare the response of standard rifaximin dosing and a combination of herbals. This is part of the biotics research approach, disbiocide and FC-cytal. So there was a superior result from the herbal combination, and there was a higher incidence of side effects with rifaximin, as noted there. So there are other trials for rifaximin that have shown a higher response rate, but in this head-to-head trial, the herbals were comparable and potentially superior. There's been a trend to add ADP to the herbal regimen, and it would be very high likelihood that this would improve the response rate even more. All right, so I'm gonna do a relatively brief case study. This is a woman who came to me, it was a new patient to me, 67-year-old, just saw her at the end of July, and she was very sick, loose bowels, abdominal pain, losing weight, and this is not intended to be a criticism of gastroenterology, but for some reason, the gastroenterologist found that she had pancreatic enzyme deficiency, or insufficiency rather, but didn't manage it. So that was, again, it's a sort of a side point. But so based on her history, some of the details of the history, I thought that parasites was potentially the root cause that was even more than pancreatic insufficiency. But it was easier to do a SIBO breath test. And being aware of this very high percentage of people with chronic gastrointestinal issues having SIBO, I changed my order of approach, and I ordered a SIBO breath test from AllClear, and the results came back in under 48 hours. I think it was actually the next day or maybe the morning after that, that she had methane SIBO. So to reinforce some of the principles of functional medicine that are part of this presentation, we really need to investigate the root causes of each individual for something like IBS if we want to cure it, resolve it, truly improve it rather than manage it. It's always better to individualize rather than take the same cookie cutter approach. And we're seeing more and more collaboration between complementary and alternative treatment approaches. And one of the ways that traditional providers discount non-pharmaceutical approaches is to say that there's a lack of evidence. That is often not the case. The provider is probably just not aware of evidence or hasn't done a search. And this Johns Hopkins study from 2014 is a good example of that. So again, continuing on the most important points, we always want to do a history and physical, obviously, but SIBO breath testing should be one of the first things pursued, and that's just based on the data, that's based on the numbers, and for no other reason, because you are going to get, the provider who are SIBO breath testing is getting a lot of positives, And that may not be the only cause, like the case that I just presented. That patient, that 67-year-old woman, had methane SIBO and pancreatic insufficiency and potentially other things in play. But we really had to know that she had methane SIBO to get her on the right path. Another early option that someone could consider, especially if cost is a matter, is to give up gluten and or dairy for at least 2 weeks, preferably 3 or 4 weeks, to see if the symptoms improve or resolve. This is simple and difficult, of course, but it is worth pursuing. There are, of course, different forms of elimination diets. One form is where you remove things one at a time, and the other form is where you strip it down to the absolute basics and then add things back one at a time. Next one. Okay, so that's the end of the presentation. I thank you for attending and listening, and we certainly should have time for some questions.
Got some plan on.
Yeah, good. Okay.
Thank you so
Hopefully.
much for that, Dr.
Yeah.
Lenhardt. That was great. All right, yes, we do have some questions. We've got some time. So let's see. Let's see. Dr. Lenhardt, do you have any thoughts on breath testing that includes hydrogen sulfide as well as hydrogen or methane?
Well, I mean, maybe I'm not sure I'm understanding the question correctly, but part of the presentation was advocating for breath testing for anyone with chronic gastrointestinal symptoms. And the goal would always be to check for methane producing organisms and hydrogen producing organisms. So
I think Dr. Hahn might say that the data isn't all there on the hydrogen sulfide testing yet, whereas the data is.
So I was just talking with Bill, who works for AllClear. So I'm an advisor at AllClear, but they have a medical director who's a gastroenterologist, and acknowledge that the hydrogen research, hydrogen sulfide is not. There needs to be more research into that particular element of it. Yes.
Okay, gotcha. Which lab test specifically do you think is best for parasites?
So it would depend on the level of, like anything, it would depend on the clinical judgment and how likely this is. You know, if a person says, I went to sub-Saharan Africa for a month, and ever since then I've had loose stools and intermittent abdominal discomfort with grinding my teeth and an itchy bum, well, I'm going to say that parasites for that person is probable. What I would tend to do, so personally, I would start with ova and parasite testing through a regular lab, because I'm trying to run things through insurance when I can and save people money. And then I would either do comprehensive stool analysis through an outside lab. There are many of them, or there are 2 labs that I know of that really focus primarily on parasites, parasitology and parawellness. I think parawellness is in Colorado and parasitology is Arizona. I was using parawellness. I hope I'm getting these names right. And then I found parasitology was less expensive, so I switched over to them. So if I have a very high incidence of suspicion for parasites, that would be a typical process for me. Sometimes I will put people on antiparasitics. Obviously, we would prefer to have objective results to guide our decision making, but that is an idealized world, and we don't live in that world per se. So many of the things that we need to do to provide care, we have to push the envelope a bit, in my opinion. So there are scenarios where if I feel like it's safe based on probabilities, I will manage something even without a test result, even if that's not ideal.
Okay, all right. So we've got a few questions about mast cell activation syndrome, MCAS. Which lab tests can be done for that?
So my thinking on the subject has changed over the years. This is a very, very, very important issue, and it really needs to come into the light. So I think it's worth, since we have time, spending just a few minutes on this because it's so important. So I've heard about mast cell activation for many years. I essentially didn't pursue it, and I kept hearing about it, and finally I said I had no choice. I got Afrin's book, Never Bet Against Occam, this 500, 600 page book, read that. That was, and ever since then, it's been a part of my practice. But so for a while, what I would do is I would order histamine levels in the blood and tryptase levels in the blood. And sometimes there are other markers you can check in urine, spot urine or 24-hour urine. So for a couple of years, I would do those tests. The problem is most people with mast cell activation have normal tryptase levels, so it's very unreliable. And histamine levels are very difficult to interpret because histamine levels can go up or down based on a person having ongoing allergy, more traditional allergy issues, or even as a reflection of methylation status or mast cell activation. So even histamine levels are not reliable. Urine tests are more reliable, but more cumbersome. In the end, when I see somebody with mast cell activation nowadays, I don't do any testing for them because I know that it is not going to be reliable or definitive, and I manage them on clinical grounds. And I've also changed my approach just for providers who are interested. Again, it's a very complicated subject, and I'm not going to be able to cover them, but I would argue that I start now with ketotifen 1 milligram 3 times a day and quercetin 500 milligrams 3 times a day as mast cell stabilizers. The mast cell experts will do they all do the same thing. We have a high-level expert in Boston, Dr. Castells, who I think is taking a sabbatical right now, but they all do antihistamines, H2 blockers, some do leukotriene inhibitors and mast cell stabilizers. But the mast cell stabilizers like ketotifen, quercetin, and chromal and sodium are really more important because you really want to stabilize things on an upstream basis rather than manage the end point of the cytokine release. But very important issue.
Yeah, for sure. Another question we got was, do you have a preferred stool test that you use?
The 2 stool tests that I've used, presumably the person is referring to the comprehensive stool analysis, the Genova GI effects and the diagnostic solutions GI map are the 2 that I've used probably the last 7 or 8 years. Yeah, so those, it's a treasure trove of information, pages and pages, 8, 10, 12 pages of information about digestion, absorption, immune response, dysbiosis, overgrowth, parasites, bacterial infections. I'm probably forgetting half of it. It's like, really, it is so much information that is so important, and the gut is obviously at the center of the action. This comprehensive stool analysis should be part of every gastroenterologist's repertoire. It should be taught in the medical schools. Of course, we need more research into some of the details and subtleties of management, but it's an incredible amount of information that's incredibly useful for people that know how to interpret it.
Yeah, for sure. Are there any markers in standard CDSA that could be indicative of SIBO if that test is run first?
CDSA?
Not sure I understand the question.
Can you say the question again, please?
Yeah, are there any markers in standard CDSA that would be indicative of SIBO if that test is run first?
CDS.
It must be comprehensive stool diagnostic stool analysis. Yes, like for example, in the Genova GI effects, one of it's like page 7 or 8, one of the parts of the analysis is looking. It's a really important page because it looks at maybe 20 different types of bacteria, and then I've seen people that had out of, let's say 20, I don't know the exact number, but on this one page on the GI effects, there'll be 20 different bacteria, and then it gives you the norms of what would be expected in a healthy microbiome. I've seen people where 10 or 12 or more of these bacteria are deficient, and that would be the predominant issue that they need. So because you can't just give people with gastrointestinal problems probiotics or prebiotics. I mean, sometimes it works, usually it doesn't work, because you really need to be much more specific in your approach and just giving everybody fermented foods and prebiotics and probiotics. So if the person has deficiency of good bacteria, then that gives you objective information to work on that. It also, I've seen people who had 10, 12 or more of the different bacteria in an overgrowth state. And this is a long-winded circular way, but the point is, one of the bacteria that they check is Methanobrevibacter smithii, which is the predominant organism for methane SIBO. So if I see overgrowth of M. smithii on the GI effects, that is one giant leap to say that person probably has methane SIBO. But the breath test would be more definitive on that question.
Okay, yeah. Okay, another question we had was, can you repeat the biotics products comparable to rifaximin?
Yeah, so it's dysbiocide, DYSBIOCIDE, and FC-cidal, FC-CIDAL. And then the newer addition is ADP, which is oil of oregano, which has been one of the darlings of the naturopath world for many years. So my trusty sidekick Bill you went by it, but yeah. So the dosing obviously is important. So in the original biotics research study through Johns Hopkins, they did two dysbiocide twice a day and 2 FC-cidal twice a day. If you look on the biotics research website, it will give you the details. So these are both combination herbals, which is a very typical approach. Like my favorite sleep remedy is Somnipure, which has like 4 or 5 different herbals, especially valerian root. So it would be more typical in the natural world to do multiple agents synergistically.
Okay. And then will the SBO kit work for both hydrogen and hydrogen sulfate?
Or sulfide, you mean?
The SBO kit for SIBO, that's probably a question for
Martin's. No, SIBO kit. They're asking if the SIBO.
Oh, the breath kit, the breath test, or the SIBO kit. Yes.
Which are your? Oh, you mean the biotics research kit? Is that what you think they're referring to, Emily?
Yes, I think that's what they're asking.
Yeah, I'm not sure. It probably would be worth sending an inquiry into biotics research. I'm not sure about that one.
Okay. Let's see what else we have. Oh, can you speak about biofilms?
Yeah, biofilms is another. The scope of it is not been clarified, but it is a massive issue, and it's a fascinating issue on some level, because what I've read is that 80% of the bacteria in the body can produce biofilms. Fungal species can produce biofilms. If you look at an evolutionary tree, if this is, so it's either that bacteria and fungal species develop this defense mechanism independently, which is interesting, or it was a strategy that goes way back on the evolutionary tree, back a couple 100 million years, to some common ancestor of the two, which would be even more mind-blowing. But so the biofilm is produced, and the amazing thing is different types of bacteria, and even conceivably a bacteria and parasites, can work collaboratively. I think it's through a process called quorum sensing, where these organisms communicate with each other, and they make parasites. They make the biofilm, which is a slime layer that walls it off. And so this comes up quite a bit in mold toxin illness with MARCoNS in the sinuses, which is multiple antibiotic resistant coagulase negative staph, which are biofilm reducing. I do that nasal sinus culture all the time on people, including somebody just yesterday. But it definitely comes up within the gut. There are many people that say that you need a biofilm buster with your regimen. I'd love to see a study. I mean, maybe biotics research can run another study and do the new regimen with a biofilm buster, and see if that increases the efficacy even further. That we need that type of research, really. But yeah, biofilms are basically blocking the immune system, blocking antibiotics. I would say the one that I'm most familiar with is Interphase Plus, which has been around for quite some time, and I think probably would be the #1 preferred gut biofilm buster in the functional integrated naturopathic community. That would be my guess. I don't know for sure. But you know, it's incredibly common. It needs to, just like mast cell, it needs to be considered more, addressed more, researched more, treated more. It's an explanation why treatments don't work. And so many of these things, I have a friend who's an ENT, and I asked him about biofilms in the sinuses, and he said, oh yeah, you know, we do sinus surgery. We see it all the time. Because it's basically like if the mucus is thick and viscous and slimy, and you know, it stays together, then that is biofilm, almost without. He said, "Oh yeah, we see that all the time." I said, "Wow, well, it's great. Okay, well, what do you do about it?" Like, well, we don't really do anything about it. But and the list of biofilm busters goes on forever. So if you do like an internet search on biofilm busters, it's everything from, I don't even, like colloidal silver to chlorella to, you know, apple cider vinegar. And so when I see these lists, I say, wow, this is amazing, all these biofilm busters we can use. But how in the world do I know which of these biofilm busters is more effective? I'm guessing there's no research behind it, and I'm not even sure where these lists come from. I don't know how they're verified, but that's, again, another long explanation of, but I'm talking about it quite a bit because I think it's very important.
Yeah, for sure, for sure. So the breath test, does the breath test require a prescription? Can a nurse practitioner prescribe it? Is it able to be delivered at home? Just some questions about the breath test.
So it does need to be ordered by a healthcare professional, MD, NP, PA. I think in most situations, a naturopath. lot of different types of providers can order it. I'm pretty sure that they can't, or nobody can order it themselves, right? It has to be from, I'm asking Bill, who works for AllClear.
I think you can order it, but we will, through various channels, add a doctor's order to it for an extra 35 or 40 bucks.
Okay. So different ways around. Yes, it'll be shipped right to the house, right?
Yeah.
And it's very easy to do. It's incredibly easy. Quick turnaround. So like for $146 or $149, that is much less expensive, and for the newer gold standard approach based on their technology. So it's it's a much more accessible now than it's ever been.
There are a couple of Byzantine states that don't allow you to order a breath test to come to your home. So, for example, New York.
Oh yeah, yeah. New York is special in many ways, but New York, a lot of times, if you're ordering some integrative test or like SIBO test, it'll say not in the state of New York. So I'm not sure why they're being so.
You just have to go through your doctor.
Okay.
Okay, well, is there anything else that you would like to say about breath testing before we kind of wrap it up?
No, my goal was to look at IBS from a root cause perspective, and to try to make the approach as simple and straightforward as possible. And I think if somebody has 5 signs of thyroid dysfunction, then they need a full workup there. If somebody has signs of maxill activation, I think they need an approach there. Although, and again, I don't know the background of our audience, but things are changing and improving, but very slowly. So, for example, in my 20+ years on the North Shore of Boston, there's not a single endocrinologist that will order a free T3 level. I think there was one a number of years ago, and I don't understand that. And the allergists are not that interested in mast cell activation, and the ENTs don't care about the biofilm, and the gastroenterologists are coming along slowly to these things, but they're not going to pursue things. Most of them won't pursue things quite in the way that we've been discussing. So, I mean, if you have medical doctors, traditional doctors and specialists who will take these approaches, beautiful, awesome. But there potentially is a need to find a functional provider, an integrated provider, a naturopathic provider, and they will all be probably versed in all of these or most of these topics on some level, and they will be familiar with SIBO breath testing.
Okay, well, all right. Thank you so much, Dr. Lenhardt, for this informative and outstanding webinar and this wonderful Q&A. And thank you to all of our attendees for joining us today. For any questions we were not able to answer, I think we got to just about all of them, but you can send those to communications@bioticsresearch.com. Again, all of our webinars are recorded and uploaded to our website within 24 hours. Thank you so much, everyone, and have a great day.
Thank you.